Welcome to the Congress Agora 2022. We are here with Doctor Francesco Bernardini.
Hello, welcome to everybody. Thank you for having me.
It's a pleasure. What are the innovative contents, the confirmation that you want to highlight regarding your participation at the Congress?
At this Congress in particular, but every time I have the chance and the opportunity to present and to publish my work, I like to put in highlight the area around the eyes, the periorbital area, which is an area expanded that goes from all over the forehead down to the cheek and center around the eyes, because this is the first thing that everybody look at when meeting somebody, when it's our business card, and that makes us who we are for ourselves in front of the mirror and for everybody else. So if we can approach this area and do something to improve, to refresh, while keeping it natural and inconspicuous, that is our message to deliver, being with surgery, being with aesthetic medicine. So it's very important for me to put in highlight this area. Focus on the beauty of the face is all around this area, and then comes everything else. So it's something that I find innovative, because everybody usually focuses on the side view, the sagginess of the other areas, and this comes later. This for me is what is the most important part, is my training is about that. So I need to send my message out like that.
Thank you. As for your experience, are there any specific recommendations for your colleagues?
My colleagues, I tell them to not follow my path, but in general, yes, be hungry and be foolish, meaning follow the education, the highest point of your experience. Go to learn. Everybody can teach something to everybody else, and focus on the result, not invest in the making easy money immediately, maybe later on, but you become better at something and you are the next leader or the next trainer in this field. So invest in your training, never stop learning, and go visit the ones that you think are better than you.
Good message. The aesthetic medicine is becoming more safer and ethical. Are there any clinical findings and recommendations for patients?
Yes, I tell patients to focus and aim to achieving natural results without overdoing it, and that's my job, to put a line between the patient that asks too much because they try to fill a gap they have inside and they ask us, but it's for us to guide them, tell them it's enough, let's do something else, or let's focus on this other part, or not do nothing at all. But we need to guide our patient to achieve what is the best result possible for them, and never letting the easiness of selling a treatment, selling something to them, because in this we follow a path that will bring not to, but the opposite of beauty, which is not something for us.
Let's talk about beauty. We have evolved towards an interpretation that is increasingly authentic. What is your opinion about it?
Being an authentic result is very difficult, because everything we do, being with surgery or with aesthetic medicine, with injectables, everything can take a twist that makes it that you can see that something has been done, even though you cannot name it. You know from the smile, from the expression, that something happened to that face that put it off what is the natural, which is something that I really never want to see in my patient. So there are always ways of improving that. It's a technical mistake at a limit of the practitioner in that sense. For me, it's very important to achieve always a natural result, and the nice, in the end, then the perfect result for everybody else, for everybody, for us, being able to make the patient more beautiful without anybody noticing it, that is a good aesthetic medicine. People should not be recognized as anything done. They should only be seen as being improved, being better looking, but nobody can tell. What you see That's funny. It's a poor aesthetic medicine. So you shouldn't be seeing anybody to be touched. That is the secret. So
you're totally right. Well, thank you very much, Dr. Bernardini, for your important contribution, and have a nice day.
thank you very much. I will surely will.